Namaskar, welcome back. I'm Dr. Biplab. So today I'm going to talk about a very important, whether you say misconceptions or there are so many queries which is being there in current pandemic of corona COVID infections. So you see there has been vaccination drive which is going on from government of India and from across all over the world, right? So one of the queries, being I'm a neurologist and neurointervention, one of the most common queries which I get is like, doctor, my patients or someone of my relative got a stroke earlier, so can he or she take vaccine or not? The answer is absolutely yes. You can and should take the vaccine irrespective of whether you had a stroke earlier or not, number one. The second common question comes is like, the person is on blood thinners. Whether there is a risk of taking the vaccine or whether he or she can take the vaccine or not. The answer is again absolutely yes. You should take vaccine even if the person is on blood thinners. So just to elaborate slightly more, the blood thinners are different types actually. It can be antiplatelets, it can be anticoagulants. The persons who are on antiplatelets, either single or double, they can go for taking vaccinations without any hesitance, without any fear. Well, if you ask me whether there is a relative increased risk, though somebody who is on blood thinner, the chances of bleeding is relatively high, but giving an intramuscular injections, what may the chances? The chances of getting a hematoma may be slightly high, but saying so, it does not mean you should not get vaccine. You should definitely get vaccinated. If somebody is having blood thinners in the form of anticoagulation, if you have very queries, you have some fear, then you can do INR. That's measure the how much blood thinning is there. So you can do INR, and if it is within the therapeutic range, you can go ahead and take vaccination without any fear. So what are the things that can very rarely happen after taking vaccination is sometimes you can have a hematoma. What is hematoma? The slight collections of blood can happen, the chances of which is very, very less. So if you take the weightage of what is the risk of getting infections and of COVID and the benefit of taking vaccination versus benefit, risks of your getting that simple small hematoma, it's definitely very high. Okay, you should in single line, what I want to say that you should definitely go ahead and take vaccines if the person is taking any blood thinners or if the person had earlier any stroke. Thank you very much.